The hantavirus outbreak that alarmed the world. It began as a luxury expedition through one of the most remote regions on Earth. Passengers aboard the polar cruise ship MV Hondius were traveling through the cold waters of the South Atlantic after visiting southern Argentina, a region known for glaciers, mountains, and untouched wilderness. But within days, what started as a routine voyage transformed into an international health emergency. It has now captured the attention of scientists, governments, and infectious disease experts around the world. Several passengers suddenly became ill. At first, the symptoms appeared ordinary: fever, fatigue, headaches, muscle pain, symptoms so common they could easily be mistaken for influenza or exhaustion after travel. But then some patients deteriorated rapidly. Breathing difficulties developed, emergency medical interventions were required, and within a short period of time, multiple deaths were reported. Health authorities soon confirmed the cause: hantavirus. More specifically, the Andes strain of hantavirus, one of the rarest and most concerning forms because it has demonstrated the ability to spread from person to person. That single detail changed everything. Today, passengers and crew from the MV Hondius are being monitored across several countries, including the UK, Spain, and Switzerland. International contact tracing operations are now underway involving the World Health Organization and the European CDC. The CDC has reportedly activated a Level 3 emergency response coordination system, not because experts believe this is another COVID-style pandemic, but because outbreaks involving human-to-human transmission are exceptionally rare. To understand why this has triggered such concern, we first need to understand what hantavirus actually is. Hantaviruses are a family of viruses primarily carried by rodents. Humans usually become infected through exposure to microscopic particles from rodent urine, saliva, or droppings. When contaminated material dries out, viral particles can become airborne and enter the lungs when inhaled. In many cases, infection occurs in cabins, rural buildings, campsites, or poorly ventilated areas where rodents have been present. In Europe and Asia, hantaviruses more commonly affect the kidneys, causing hemorrhagic fever with renal syndrome. In the Americas, strains like the Andes virus can attack the lungs, leading to hantavirus pulmonary syndrome, or HPS. And HPS is terrifying. The disease often begins deceptively mildly. A patient may simply feel tired or feverish, but after several days, fluid can begin accumulating inside the lungs. Blood vessels start leaking. Oxygen levels crash. Patients can suddenly require intensive care and mechanical ventilation within hours. Mortality rates for hantavirus pulmonary syndrome can approach 30 to 40% in severe cases. The Andes strain is unique because it has repeatedly shown limited human-to-human transmission through close contact. This makes the current cruise ship situation especially concerning. A cruise vessel creates the exact environment specialists worry about: shared cabins and enclosed ventilation systems, crowded dining areas, close interpersonal contact, and prolonged exposure over days or weeks. Investigators are trying to determine if the original exposure happened during excursions in southern Argentina. Argentina has already been reporting a noticeable rise in hantavirus activity over the past year. Researchers suspect several factors: climate change, shifting rodent habitats, and expanding human activity into previously isolated ecosystems. This is part of a larger global pattern: the growing emergence of zoonotic diseases that jump from animals to humans. COVID-19 reminded the world how disruptive such outbreaks can become. But experts emphasize, this hantavirus outbreak is not believed to represent a comparable global pandemic threat. Unlike COVID-19, hantavirus does not spread efficiently through casual airborne exposure. Still, public health agencies are taking no chances. Nearly 150 people are undergoing monitoring. Another major concern is the absence of targeted treatments. There is currently no universally approved vaccine. Treatment mainly involves supportive intensive care, oxygen therapy, ventilation, and fluid management. That means early detection becomes critical. Clinicians are being urged to remain alert for symptoms. Symptoms may include high fever, severe muscle pain, fatigue, nausea, and eventually shortness of breath. Authorities stress that the overall public risk remains low. But the outbreak has become a reminder that in an interconnected world, humanity remains deeply vulnerable. Even now, scientists continue racing to understand exactly what happened aboard that ship and whether this was an isolated incident or a warning of something larger still to come.